One program in Canada is making waves and catching international attention for an alternative approach to helping those affected by alcohol addiction. The program reportedly not only offers a home to alcoholics who lived on the streets, but also a happy hour of sorts where they serve alcohol. Join us via Skype to talk about this is the medical director of Ottawa Inner City Health, Dr. Jeffrey Turnbull. Dr. Turnbull, thank you, sir.
Welcome.
First things first, can you just explain this program and what inspired it?
We recognized very early on that if we were trying to help refractory alcoholics, those people living on the street, failed abstinence programs, then what we needed to do is to bring them in and provide them physical care, mental health support, and addiction support. And the only way we could do that was to actually give them alcohol. It's a drink an hour. It starts in the morning, ends in the evening. And with that, we bring them into a community, we give them support, and we progressively reduce the amount of alcohol that they get. And some stop, some don't, but they all regain their lives.
So these are hardcore alcoholics, because there was a gasp in the audience when you said a drink an hour, pretty much through the whole day. I'm assuming that you're referring literally to those who are the worst off with their alcoholism.
In our program, once they're stabilized, they're drinking about 1/9 of what they were drinking on the street.
I'm curious, I didn't realize your ultimate goal for some is to wean them off. I mean, how successful has this been?
It is our goal. So what we do is every week, we sit down with them, we discuss the amount of wine that they're drinking, we try and reduce it as much as we can. Some we're able to stop, but I have to say the majority is that they still remain drinking. Remember that they've been drinking on the street for 30 years. And these are the people that you and I like to walk around, intoxicated in your emergency departments, in your police cells. These people now live a life where they're part of a community and contribute to that community. And yes, many of them are still drinking. We love it when they stop, and I don't like seeing any of them drinking.
This sounds at first blush like a crazy idea. I want to bring in to the conversation addiction specialist and psychotherapist, Dr. Mike Dow, because as crazy as it sounds, there are some elements to it that do make sense. In your opinion, do you think this approach can be effective, or is it just dangerous?
Well, listen, I trained at Betty Ford, and I think most people in America in the traditional alcoholism, abstinence-based programs would just be shocked in horror when they hear about this program. You know, I do believe in the power of replacement therapy. But, you know, what I have to say is usually in replacement therapy, we're trying to get patients to trade down, right? So from heroin down to something less harmful like methadone. Or if somebody's smoking, we're using something like Zyban, something that is going to give them the dopamine that they need. My main concern is, isn't this on some level saying it's okay to keep drinking, and it's so available every single hour that, you know, I'm great that that they want them to wean off. I would just say that the typical patient, as he said, the majority of them stay drinking. Does it also feel like we're just sort of giving up on these people? Like these are the alcoholics that we just sort of want out of our society? Because that's the other thing that it feels like to me. I'm sure you've been told that before.
Yeah, and so I believe in abstinence. There's no question. I want them to stop drinking. I just feel that I can't abandon these people to the streets. They're now part of a community. Their quality of life is improved. They're getting mental health care. They're getting physical care. Some of them are still drinking. They're not drinking every hour.
But then why leave? It seems like it sort of is keeping you stuck, right? You know, I think in prison population studies, we know that people who were on the street drinking a liter of vodka a day, it may not be easy.